Let's talk about the pelvis inlet. It's the female pelvis. It is pubic symphysis. We are talking about the inlet of the true pelvis. The circle being outlined. It is the true pelvis. It is pubic symphysis followed by crest, then the pubic tubercle, superior pubic ramus, iliopubic reminence, iliopectineal line, sacroiliac joint, ala of sacrum, sacrum promontory. Similarly, onto the opposite side, sacroiliac joint, iliopectineal line, iliopubic eminence, superior pubic ramus, iliac, pubic tubercle, pubic crest, and again the pubic symphysis. This is how the pelvic inlet is formed. The female pelvis is further divided into three parts: the pelvic inlet, cavity, and the outlet. Talking about the inlet, there is anterior posterior diameter, there is oblique diameters, and there is transverse diameters. Talking about the AP diameter, the AP diameter is divided into three parts that are true conjugate, obstetric conjugate, and diagonal conjugate. Talking about diagonal conjugate, the diagonal conjugate is from the lower border of the pubic symphysis to the promontory. It is the only major diameter, anterior posterior diameter, which is measured by two fingers from sacrum pubic symphysis to the sacral promontory, which measures to 12 centimeter. Following this, there is the obstetric conjugate. The obstetric conjugate is from the midpoint of the pubic symphysis to the sacral promontory and forms the obstetric conjugate. The diameter is 10 centimeter, and only from the inner border of the pubic symphysis to the sacral midpoint of the sacral promontory there is your true conjugate, which measures about 11 centimeter. The true conjugate and the obstetric conjugate are derived from by subtraction of this from the diagonal conjugate. Following this, we talk about the cavity. The pelvic is the segment of the cavity is the segment of the pelvis bounded above by inlet and below by the least pelvic dimension. Shape is almost round. The plane extends from the midpoint of the posterior surface of the plane extends from the midpoint of the posterior surface of the pubic symphysis to the midpoint of the second and the third sacral vertebra. It is the plane of the cavity, which may in anterior posterior 12 centimeter and oblique is also 12 centimeter. Following this, there is outlet. So now talking about the outlet, I'm just reversing the pelvis. These are the ischial tuberosities, and the transverse diameter is between the two, that is the ischial tuberosity, that measures 11 centimeter, and the anterior posterior diameter is 13 centimeter, and the anterior diameter lies is from the tip of the coccyx to the lower border of the pubic symphysis. Okay, so this is the anterior posterior diameter, and the this is between the two ischial tuberosities is the transverse diameter, and along lower border of pubic symphysis to the coccyx it is. Now talking about the plane of the obstetric outlet, so it includes the lower point of pubic symphysis, ischial tuberosity, coccyx, ischial tuberosity. So this is the plane of the outlet. Now we'll talk about the plane of the least pelvic dimension. The plane of the least pelvic dimension is the narrowest plane in the pelvis. This plane roughly corresponds to the origin of the levator ani muscle. It is At this plane that the internal rotation of the fetal head occurs, it marks the beginning of the forward curve of the pelvic axis. It is a landmark used for pudendal nerve block analgesia. Yeah. This level of ischial spine indicates the station 0.